Hello again, John Clark here. Today's topic is orthotic therapy. We use orthotics for the classic flat foot problem. Flat feet can cause a surprising number of symptoms throughout the body. Often we see patients with back pain, for example. Chiropractors are known for treating back pain. But sometimes it's not actually the back, it's the feet that are causing the problem. So here's an example where someone has actually one flat foot. And when you have one flat foot, it lowers the body on that side. It doesn't make the leg actually shorter, but it does lower the pelvis. And then the spine has to compensate for that, as you see here. So someone could have shoulder pain, they could have neck pain from compensating for this. Certainly back pain, knee pain, hip pain, ankle pain. So rather than treating the location of the pain, which is really the effect in this example, by treating the cause, by raising up the arch, then the forces run properly through the leg and lower back, and the posture improves. And then in that example that I gave, neck pain, mid back, low back, knee pain, all these pains will go away because we treated the cause. So when we do an examination for someone who has pain, we don't look at the one little piece, we look at the whole body, okay? We take a holistic approach, because if you don't treat the cause, you only treat the effect, well, that won't work very well. You will only get temporary results. So the philosophy for everything we do here in the clinic is to treat the cause rather than just the effect. So getting back to orthotics, flat feet, very, very common. I would estimate probably 75 to 80% of people have less than perfect feet. Not everybody has totally flat feet. You can have variations, okay, half flat, if you will. But there is an ideal arch for the foot. Now, unfortunately, it's very difficult, almost impossible, to bring the arch back once it flattens out. So what you need is a custom-made orthotic. I personally have flat feet, and always will wear orthotics. The odd time when I forget to wear them, that's when I personally really notice the benefit, because I'll get very tired here in the clinic, or I'll get some lower back pain, okay, because I have to compensate for my flat feet. So 99% of the time I wear my orthotics. So if you have issues with pain anywhere in your body, there's a good chance that half the problem, or maybe the whole problem, is flat feet. So it's very important to have that assessed. And we make the orthotics by taking a mold of the feet. We use this casting foam. We put the foot in the corrected position, and we take a three-dimensional mold. This goes to a lab, and they come back with a product that looks like that. So there's the arch, the corrected arch. Also, if someone has a leg length discrepancy, so here there's a lower leg because of the arch, but sometimes it's actually an anatomical leg length difference. Again, we can't directly treat that. We don't have a leg stretcher, but you can put a heel lift. You see it on there. You can put a heel lift on the low side to balance it out. So just like a house, when we're treating spinal pain, for example, one of the keys is to get that pelvis balanced out. If the pelvis is twisted, the body compensates, and inevitably it causes pain. Now, I mentioned personally I get tired if I don't wear my orthotics. So if you're working at a job where you have to stand a lot or walk, and you feel like you're tired, chances are it's from the orthotics. There was a research study done where they took people with flat feet, they put them on an elliptical trainer or a treadmill, they measured their oxygen consumption, then they put them in orthotics, and what they found was they had half the oxygen consumption, so therefore their bodies were twice as efficient. So that's what I noticed. My body's more efficient, I don't get as tired when I wear my orthotics. So if you have pain or if you're tired, you have to look at your arches. Maybe that's the cause. So as part of our exam, we always look at the feet. So give the office a call. We can assess your whole spine, and including the feet, and we'll figure out what's wrong to help you recover your health. So give us a call, and we'll put you back on the road to recovery. Thanks for listening.